Welcome to our roundtable discussion on imaging of the heart. My name is Kamran Haleem. I am Director of Echocardiography at Vassar Brother Medical Center. Advanced cardiac imaging is the cornerstone of any excellent heart workup. At the Heart and Vascular Institute, Nuvance Health has recruited specialists from across the country in state-of-the-art imaging of your heart. Today, we're joined by three such experts, and they will give us their insight into advanced cardiac imaging. I'll introduce our panelists for you. Our first panelist is Dr. Margaret Bond. She is Director of Echocardiography at Danbury Hospital. Our second panelist is Dr. Joseph Burdowski. He is Director of Cardiac Imaging at Danbury Hospital. Last but not least, Dr. Anthony Messina is Director of Nuclear Cardiology at Vassar Brother Medical Center, as well as the Director of Cardiac CT at Vassar Brother Medical Center. Thank you all for joining us today. I'll start with Dr. Bond. Dr. Bond, tell us a little bit about echocardiography and the role it plays in the evaluation of patients with symptoms related to the heart.
Absolutely, and happy to be joining you all today. Echocardiography is in some ways the cornerstone imaging tool used in cardiology, and often the first thing that we order when we're trying to evaluate a patient. Part of that is it is such an easy procedure. It's relatively quick. We can get the procedure done within usually 20 minutes or so, sometimes 30. And it is an ultrasound technique, which is easily accessible and safe and doesn't involve radiation, and can be done at the bedside with minimal effort, both in terms of for the patient as well as the sonographer who performs the exam. Some people often refer to this as an extension of our stethoscope. So, we take a listen to someone's heart and we can hear things like murmurs and have other things that give us a sense of whether there might be pathology. This ultrasound technique similarly is using ultrasound and sound waves to make diagnosis, but gives us a whole lot more information. When we think about this procedure, we can also do it in a number of different venues, including not just in the office or in the clinic, but also in the hospital. And when somebody is very sick, we can do this right at a patient's bedside. This allows for quick determination of somebody who's, for instance, acutely ill, and we can evaluate somebody in the intensive care unit quickly in order to make decisions even on a very urgent basis. We also use this echocardiography to guide procedures. So we'll be sometimes in the operating room helping surgeons and our interventionalists make decisions about procedures, including with the heart valves. So I would say that echo is a wonderful procedure for also just being able to tell us so much. And so not just appealing in how easy this procedure is, but also just how much information we get. So we can look at things like the function and squeezing function of the heart. We can look at things like the thickness of the muscle of the heart. We can look at the heart valves and whether they're stiff or leaky, kind of like when somebody has a murmur on exam. If somebody says you have a heart murmur, often this echo can then tell us if there's an issue with the heart valves or with the outflow of the heart. We can even see about things like fluid around the heart, which can sometimes be a very important prognostic tool as we try to evaluate somebody's symptoms. We can see things that even are non-cardiac in a way, like effusions that are in the lungs or even masses in the heart. It also can give us a clue as to why somebody has things like shortness of breath or swelling in the legs, whether there's a cardiomyopathy, meaning a sick heart muscle, but also if there's problems with isolated wall motion that might indicate something like a person having had a heart attack in the past. So certainly this is a easy and safe tool, very similar to the ultrasound even used Often people are very familiar with the ultrasound that's used to look at a baby in a woman's abdomen. Similarly, this is so safe and easy and can really give us a whole lot of information. And I am sitting next to, in my heart monitor here, just an example so that one can see that this is just the ultrasound giving us heart, both the left and right side heart, and giving us information about valves. So the echocardiogram is a tool that is used frequently and commonly in cardiology to give us a whole lot of answers about what's going on with the heart when we're trying to understand if there is a heart issue.
Dr. Bond, thank you for sharing your expertise and insight, and as well as for the show and tell. One other question for you. When one of our patients has an echocardiogram ordered by their physician, what should they expect on the day of the procedure?
So essentially, they'll come in and be introduced to the sonographer. So the sonographer is a technician who's going to acquire the images, take those pictures. And they will bring them to a room where there's a special table where the patient will undress to have a gown on top and will lie flat on a table. Actually, I have a picture of this for you as well. So glad you asked. I don't know if you can see it.
That's great. That's excellent. Dr. Bond, thank you very much for that insight and expertise. It sounds like a great procedure with a wealth of information that can explain symptoms that a patient may be undergoing, and gets a lot of information for our physicians to help their patients. I'll turn to you, Dr. Messina. Tell us a little bit about nuclear cardiology and what role it plays in the evaluation of the patient with symptoms related to the heart.
Thank you, Cameron. I would love to talk more about nuclear cardiology. So nuclear cardiology is a modality or imaging specialty where we can get more information about the heart. Similar to echo, we use nuclear cardiology very often in the evaluation of patients to try to assess what is going on. A lot of times patients will come to our office and will have symptoms such as chest pains or shortness of breath. So we as cardiologists will use this imaging technique to get more information on the heart that can help us take care of patients. Nuclear cardiology is mainly used to look for blockages in the arteries or blockages in the heart. There are arteries that supply blood to the heart, and over time there can be calcium and cholesterol plaque that can build up. And when this does build up, patients typically will have symptoms. And one of the best tests that we have to look for blockages is a nuclear stress test. So that allows doctors to diagnose heart disease and thus to treat patients better. In addition, nuclear cardiology allows us to look at the pumping function of the heart to evaluate if there's any weakening or a prior heart attack. So those are the main reasons that we use nuclear cardiology to help diagnose heart issues and also to help treat patients. Usually stress tests are done on an outpatient basis, meaning that you come into the stress lab, we devote a few hours to get the testing complete and all the imaging done, and then you leave that same day. And typically within 24 hours, we will have results to your doctors such that doctors can report back to you, the patient, to get a determination of what is going on.
So while an echocardiogram gets an evaluation of the structure of the heart and the function of the different components of the heart, it sounds like stress testing and nuclear cardiology plays a complementary role, and it evaluates for any coronary atherosclerosis or blockages in the heart arteries. Is that a fair assessment?
That's exactly right. So typically we like to use different imaging modalities, but in total, they help us to treat the patient. And that's exactly how nuclear cardiology or nuclear stress testing is used by doctors. We typically will use different tests or order different tests to get at the diagnosis in different ways, or gives us incremental information to overall take better care of our patients and to determine what is going on or what's causing the symptoms for our patients.
Dr. Messina, thank you for sharing that expertise with us.
Thank you.
Dr. Burdowski, tell us a little bit about cardiac MRI and how it fits into the picture of evaluation of the heart.
Yeah, so cardiac MRI is a fairly advanced imaging modality where, similar to the other modalities, we take very detailed pictures of the heart. We use magnetic fields and radio waves to accomplish this. And overall, it's a very safe modality, similar to ultrasound or echocardiograms. There's no radiation exposure. So it's very safe to undergo these tests. Most cases require the use of contrast, and it's different from CAT scan contrast that most people have had in the past. So essentially, with MRIs of the heart, we get very detailed pictures of the cardiac structure as well as the function. And it's actually considered to be really the gold standard for assessing cardiac function, how much the heart is pumping out, as well as the size of all four chambers of the heart. Oftentimes, patients come in for these MRIs after they've already had other cardiac imaging, and it may be because their primary doctor or cardiologist, has more questions about the diagnosis, wants to clarify exactly what the cardiac condition that this person has, or also to evaluate patients longitudinally over time to assess for changes in their underlying condition. Recently, it's made a lot of news and headlines because during the COVID pandemic, it's been very useful for diagnosing conditions such as myocarditis or pericarditis, which are inflammatory disorders of the heart. And this is really one of the few tests we have that can reliably and accurately diagnose this. So it's proven to be very useful. Other patients that may benefit from an MRI, if they have an ultrasound that shows decreased cardiac function, a weakened heart muscle, MRIs are often performed to try and determine why that's the case. We look for irregular muscle tissue, any scar or something called fibrosis in the heart muscle. And even patients with congenital heart defects, we can obtain a lot of information. Similar to echo, we can also assess valvular function and really how severe leakiness or blockages in the valves that there are. The good thing, as I mentioned, is that it's very safe and we get a lot of information from this test. I would say the only downside is that it can be a little bit more difficult and oftentimes limiting in patients that have certain metallic devices. We get a lot of artifact from those. We are doing these studies in patients that have pacemakers and other devices as long as they're deemed to be safe. These tests can often take a little bit longer than other cardiac imaging tests. The average length probably is close to an hour at the present moment. And some patients that are claustrophobic or afraid of small spaces can sometimes have difficulty with this test, especially since it's a little bit longer. Patients that come in, if they have claustrophobia, they can get a prescription for anti-anxiety medication that they can take prior to the test to make them more comfortable. And all of the technologists that perform these tests are very sensitive to that and can certainly understand if a patient needs a break or can't go on any longer. The day of the test, when patients come in, so they're prepared by the technologist and they have EKG leads on during the test, and that allows us to synchronize the imaging with their heartbeat and get very accurate and detailed information. And when we are taking pictures of the heart, since it's a moving structure, it's important that patients hold their breath when we're acquiring images. Every time we breathe in and breathe out, the heart shifts positions, and we want to keep the heart nice and still in the chest cavity. So what we do is we tell the patient to take a breath in, take a breath out, hold their breath, and that's when we start to acquire the images. About 10 to 15 seconds later, they breathe in normally. And this is repeated multiple times throughout the test. And again, if at any point someone needs a break or they need to relax for a moment, we can provide that for them. So again, even though it can be a little bit longer. For the right patient, it's a very important test to undergo.
Thank you. I think that was a great overview. So an advanced imaging modality for the heart, not everybody needs it, but it's there for those who do. Perfect. Thank you. Dr. Messina, last but not least, tell us a little bit about the cardiac CT department and how cardiac CT plays a role in the evaluation of our patients.
Thank you, Dr. Haleem. I'd love to. So cardiac CTA is another imaging technique that we use in cardiology. It again gives us more information to complement some of the other modalities that we've discussed earlier. Cardiac CT is most based on structure, in the sense that when we're sending patients for cardiac CTA, we're looking mainly at the structure of the heart. I spoke earlier about nuclear cardiology, and that has to do with the blood flow or pumping function of the heart. But cardiac CTA is usually a imaging technique that we are relying on when we want to get a very detailed picture of the heart. As Dr. Burdowski just had mentioned, cardiac MRI also does that to a very detailed degree. With cardiac CTA, it is a modality where you are receiving some radiation. You also receive IV contrast, which does contain some iodine. So that is something that is different about this modality as compared to cardiac MRI. And usually when we as cardiologists are sending patients for cardiac scans, the big types are either a calcium score or a cardiac CTA. So a calcium score is looking at plaque buildup in the arteries of the heart. So this is a very good test to diagnose heart disease at an early stage. And typically risk factors such as family history for heart disease will prompt us to order this test on a patient. When someone has a calcium score, there's no IV contrast that is provided or given to the patient. There's a small amount of radiation exposure for this scan, and usually it only requires a 20-second breath hold to have the calcium score performed. And with that short imaging time, we can look to see if there's plaque buildup in the arteries of the heart. To contrast this, we sometimes send patients for a cardiac CAT scan. That's a little bit more involved. And again, in this situation, we're looking more at structure and anatomical size of the heart chambers. With a cardiac CAT scan, the patient does receive more radiation than in the calcium score, and they also are hooked up to an IV through which they receive iodinated contrast. Typically, before patients do receive the scan, we need to give them some medicines to get a better picture. Those medicines are usually beta blockers to help slow down the heart because we are imaging a moving organ. Also, we like to give patients nitrates. These are medicines that help dilate the arteries so we get a better picture of those arteries. And usually with the cardiac CAT scan, what we want to look at are the arteries themselves to see if they have blockages. So again, with the cardiac CAT scan, we're mainly focusing on the arteries to see if they're blocked, and also sometimes we want to know what their orientation is around the heart to see if there are any anomalies or abnormalities with regards to the way that the arteries are coursing around the heart.
Perfect. Well, I want to thank all of our panelists for sharing their expertise with us. On behalf of the Heart and Vascular Institute at Advanced Health, we hope that you found this discussion informative. Thank you for watching. Take care.